is my pleasure to welcome everyone to the Finance and Physical Resources Committee. It is Tuesday, April 9th at 8:30. We will start with public comment. Is there any public that would like to address the Finance and Physical Resources Committee this morning? Okay, seeing none, we will close public comment, and that will bring us to the consent agenda. Is there a motion to approve the consent agenda?
Yes.
So moved. Support.
Okay, moved and
Third.
supported, and third.
Yeah.
Anything that has to be pulled? Okay, seeing none, all those in favor, please say aye.
Aye.
Opposed, same sign. The motion passes. That brings us to item 3 from the Health Department. Wayman?
Yes, this is a request to the board to approve the Health Department's Department of Licensing and Regulatory Affairs grant agreement, accept and appropriate $120,000 to the 2018-19 Health Fund budget, and to authorize the board chair or designate to execute the grant agreement, approve extensions, amendments, and increases to the grant appropriations not to exceed 15% of the original award. LARA has provided funding to be used for education, communication, and outreach regarding the Michigan Medical Marijuana Act. The Health Department will be seeking partnerships with others to provide education about medical marijuana use and safety measures and the legal, ethical issues surrounding the Michigan Medical Marijuana Program. Education will also be provided to patients and caregivers about the rights and responsibilities defined in the Medical Marijuana Act. And to support the work required by the grant, the Health Department will receive $120,000 to cover the costs of staffing, contractual, promotional, and educational materials and overhead costs. The agreement period for the LARA agreement is January 1, 2019 through September 15, 2019.
Is there a motion to approve? So moved. And support? And supported by Commissioner Wooden. All right. Questions, comments, and discussion? Yes, Commissioner Wooden.
I just have a quick question. Looking at the second paragraph of the resolution as well as the second bullet, legal and ethical issues. What would an ethical issue be through an example? What would an example of an ethical issue be?
Good morning. The ethics part really relates to licensing and the professions that are licensed, each of which has a code of ethics, so making sure that the way they're practicing is consistent with that.
Fantastic. Thank you, Adam.
Yep.
Hey, anyone else? Okay, seeing none, all those in favor, please say aye. Aye. Opposed, same sign. The motion passes. That brings us to item number 4, also from the Health Department. Wayman?
Yes, this next request is a request to approve the Health Department's Michigan Association for Local Public Health Grant Agreement and accept and appropriate $145,000 to the 2018-19 Health Fund budget, and to authorize the board chair or designate to execute the grant agreement, approve extensions, amendments, and increases to the grant appropriation not to exceed 15% of the original award. MALF has provided funding to implement the Sustaining Community-Based Immunization Action Project that focuses on increasing immunization rates among children and older adults. The Health Department will develop and implement a 13-county multimedia campaign to promote immunizations for children, teens, and older adults. The Health Department will also host a half-day training for other health departments on how to develop an effective media campaign. To support the work required by the grant, the Health Department will receive $145,000 to cover the costs of staffing, promotional and media campaigns, and overhead costs. The agreement period of the MALF agreement is March 1, 2019 through September 30th, 2019.
Is there a motion to approve? So moved. Moved and supported. Questions, comments, and discussion? Yes, Commissioner Wooden.
Just wondering, the 13 county, are the other county health departments contributing to this as well, or were we the lead grant agent for it? Or?
Yeah, thank you for that question. We actually were notified back in January by MELF that each of these counties was going to receive between $10,000 and $15,000 to develop their own media campaign based on vaccination awareness and advocacy. We had a conversation internally and then with our colleague counties that it's really tough to make $10,000 or $12,000 go very far in a marketing campaign. So our proposal to them, based on our location here in the media center of West Michigan, and because we have a communications staff, was, why don't we be a lead for that? And they were all more than enthusiastic to take that offer up. And so that's why it's really centered here. And we'll work through our radio and TV and all the media we have here that really is broadcast throughout West Michigan.
Perfect, thank you, Adam.
Yeah, thank you.
Commissioner Morgan?
Thank you, Madam Chair. Morning, Adam.
Morning.
Pretty timely, I mean, with the outbreaks of measles in the Detroit area. And is there also an education component to this, or is it just a media campaign?
Yeah, so we want absolutely to use the media to educate.
Right.
And we realize that that those who don't vaccinate, there's a portion that's because of convenience, that they haven't vaccinated themselves or their families because it hasn't been convenient. We want to overcome those barriers. That are some, of course, that are opposed on philosophical or religious reasons, and we're not going to affect them as much. Then there are others that that are open to the question of vaccination. They may have concerns. They may have heard things either on social media or elsewhere, but they're open to the science. They're open to the question about it, and we really want to work with that audience primarily to provide them with great information in order to get our overall community immunization rate higher. Yeah, because we're all very concerned about measles right now.
Right.
Yes, Commissioner Bukowski?
Thank you, Chair. Sorry for my tardiness. Thank you, Adam. How much do we do related to outreach and education in the normal course of business, had this not been made available?
It's a priority. We've got a number of members on our team who are always doing this. Health educators, Steve Kelso in communications, and others. This certainly gives us some more resources in order to broadcast those messages further. And we also do a lot of work partnering with other organizations. You may remember the Griffin's Take the Shot campaign. You still see those commercials on television once in a while. So we've got some great organizations, Meyer and the pharmacies around town that also do a great job of advocating for vaccination. So we'll continue to work in those areas. This is going to give us a deeper pool of resources for using the media.
All right, thank you.
Commissioner Sparks?
Thank you, Madam Chair. Please forgive my tardiness as well. Thank you, Adam, for making sure that we have such a great job in our health department. You guys do wonderful. I am concerned, though, however, with the immigrants and the refugees. I know the 145,000 seems like a lot, but when you start to break it down, reaching those segments and populations, how do you plan on doing that?
Yeah, so great question. We do the very best we can to work and serve all parts of the community. I just saw a report based on last month that we use translation service for 47 languages. So we are working with those communities. We are in the homes of families, especially when they have newborns. We're in the businesses. We do the very best we can. But there's still work to do. There's lots of improvement that we can make in those areas. But it's also noteworthy to understand that many of the places where our immigrants are coming from have higher vaccination rates than we have here in the U.S.
That's a shocker.
Yeah, so they're usually not a net increase to the risk that we have here. Our refugees, they're 100% vaccinated, or very close to it. So those populations don't really add risk to us here in West Michigan, but certainly we want to make sure that we have the cultural competency and humility to work with them to make sure those rates continue.
Thank you. I didn't know that. It's good.
Anyone else? Adam, I've got one for you. So as a mom of a teenager, I've learned that there are vaccinations that are around that weren't around when I was a teenager. Is there a part of this campaign for that component too?
Absolutely. So this is going to be more than measles. It's going to be more than influenza, both of which are really concerning to us right now because of the increase in the flu, even though it's springtime, and measles. But yeah, whether it's HPV or hepatitis, there are other vaccinations that we want to be pushing as well.
Great. Anyone else? All right, seeing none, all those in favor, please say aye. Aye. Opposed, same sign. The motion passes. That brings us to item number 5 from the prosecutor's office. Wayman?
Yes, this is a request to accept $75,000 from the Michigan Supreme Court State Court Administrative Office for the Youthful Sex Offender Treatment Program and to appropriate $75,000 to the 2018-19 Special Project Fund budget. The program is designed for offenders who are charged with a sexual-related offense and referred by a court, probation officer, court services member, defense attorney, or prosecutor's office. The prosecutor's office has received funding to expand the program to include all individuals between the ages of 17 and 24 who are charged with a sexual related offense. This funding will provide an increase in assessment and early intervention services as research has established that early intervention with sex offense specific treatment can significantly reduce the risk of reoffending. The agreement runs from October 29th, 2018 through September 30th, 2019.
Is there a motion to approve?
Support? Yes, approve.
And is there support? Support. Okay, moved and supported. Questions, comments, and discussion? Okay, seeing none, all those in favor, please say aye. Aye. Opposed, same sign. That motion passes. That brings us to Commissioner Miscellaneous. Is there any Commissioner Miscellaneous this morning? Yes, Commissioner Sparks.
I would just like to make sure that we keep on our radar the treatment courts. Very, very effective, very important. And I think that they will be coming before us relatively soon, but the treatment courts are very important to us.
Okay, any other Commissioner Miscellaneous? All right, seeing none, we are adjourned. Our next meeting is April 16th.